Hello and welcome to the GI Motility Clinic, a collaboration between Jewish Hospital and the University of Louisville. We look forward to serving you, and our #1 goal is to improve your health. We see patients from all over the country, and we are one of the only programs to offer both temporary and permanent gastric stimulators. This video will explain more about the clinic and the services you will receive. All patients must have a primary care provider in order to be seen, and it is recommended that out-of-town patients have a local gastroenterologist. Our clinic hours are 8:30 a.m. to 4:30 p.m. Monday through Friday. Phone calls will be answered during this time. Patients are seen by appointment only, and we do not accept walk-in patients. You can call for an appointment during clinic hours. We try to leave a limited number of appointments open each day in case a patient needs an urgent same-day appointment. The clinic and providers are not available after hours. However, there is an on-call service available. You will see one of our physicians for your first clinic visit, and will see one of our mid-level providers for the majority of your follow-up visits. None of the motility providers prescribe pain medication, and we cannot give medications or fluids in the office. Patients are required to register prior to every appointment in the motility clinic. Registration is located in the Traeger Transplant Center on the 3rd floor of the Fraser Rehab Center. Due to the high number of patients the clinic serves each day, each patient is required to arrive in the waiting room of the Traeger Transplant Center 30 minutes prior to your scheduled appointment time. Late patients will not be seen. If you are admitted to Jewish Hospital as a motility patient, you will be cared for by the hospital medical team or hospitalists. The clinic does not provide care for hospitalized patients. Hospitalists are specially trained to care for hospitalized patients and will be in charge of your care. The GI motility service will likely be consulted during your stay. The hospitalist team will manage all pain medication in accordance with the medication you use at home. Do not expect to receive higher doses or stronger medications while in the hospital. The majority of patients we see are referred to us for a possible temporary gastric stimulator. Our providers will determine if you are a candidate for a gastric stimulator. Typically, a temporary gastric stimulator is tried and will determine if you are a candidate for a permanent gastric stimulator. Once it has been determined you are a candidate for a gastric stimulator, insurance approval will be obtained prior to the scheduling of the procedure. Once the request has been made, your insurance company has 30 days to make a determination. If it is denied, we will begin the appeal process, which can take up to 1 year. The temporary gastric stimulator placement is an outpatient procedure. If you are a candidate for the permanent gastric stimulator, insurance approval will again have to be obtained. The stimulator will be surgically placed and will require an overnight stay in the hospital. For patients who are traveling from greater than 2 hours away and may need to stay locally for a period of time for a stimulator placement, there are apartments available on a first-come, first-served basis for $30 per night. There are also several hotels close to the hospital that offer discounts to Jewish Hospital patients. For further communication with your providers following your visit, we have an online patient portal that we encourage all of our patients to sign up for. It also allows you to easily request medication refills and view your medical records. You can visit www.uoflphysicians.com/followmyhealth for further instructions. We look forward to seeing you in the GI Motility Clinic.